Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Friday, December 4th, 2020. I'd like to begin by addressing the confusion out there over Christmas gatherings. As Dr. Fitzgerald has said, it's important for people to recognize that this holiday season will indeed be different. We should not have the traditional Christmas parties. Newfoundland and Labrador is currently in Alert Level 2. That means we are fortunate to be able to have some semblance of regular life, different than many places across the country. But people can still dine in restaurants and go to local shops and see a small number of their family and friends in person. This is important. We want to keep the local economy going in Newfoundland and Labrador as much as possible and as safely. We want to support our hospitality industry hit hard by the impacts of this global pandemic. Again, safely. We want to continue to see our loved ones in person. We don't want another lockdown here in this province like we see across the country. Businesses are diligently working to maintain COVID-19 safety measures within their establishments, from shops to event venues, and I thank them all for their hard work. I also thank you, Newfoundland and Labrador, for wearing your masks, keeping distance, and respecting the public health guidelines in place. You have shown that the public health guidelines are working when they are followed. Now, I recognize there is some confusion as to what is and is not okay when it comes to gatherings around Christmas. That should hopefully be cleared up here this afternoon. However, I want to assure all Newfoundlanders and Labradorians that as your leaders, we know that we are held to a higher standard. And we will always endeavor to lead by example, even for events that are within the public health guidelines. As leaders, we need to not just meet the standards, we need to exceed them and live by example. An example that you as Newfoundlanders and Labradorians can all be proud of. Our work to protect your safety and well-being is the utmost importance. And that's why we temporarily changed the Atlantic bubble as cases in Nova Scotia and New Brunswick began to rise. Nova Scotia and New Brunswick each have more than 100 active cases and have dealt with outbreaks recently. Our government continues to monitor the situation in the other Atlantic provinces closely. Prince Edward Island announced yesterday it would maintain the closure of the Atlantic bubble for another 14 days. It plans to keep that in place until at least December 21st. Our decision on Newfoundland and Labrador's self-isolation requirement for travel from within Atlantic Canada will come this Monday. However, I have some important information to share today regarding positive news, the COVID vaccinations. I have established a vaccine logistics team. It will make sure that the COVID-19 vaccine is administered as quickly and efficiently as possible. I'm wasting no time in this effort. The team will consist of government officials, including Health Minister Haggie and Chief Medical Officer of Health, Dr. Janice Fitzgerald. Commander David Botting will help lead it as well as the military is a key player here. As Minister responsible for Indigenous Affairs and Reconciliation, Labrador Affairs, and the status of women, Lisa Dempster is also on the team. So is Environment, Climate Change, and Municipalities Minister Derek Bennett. In order to be ready to administer the vaccine to the province's most vulnerable people as soon as it becomes available. Stay safe, Newfoundland and Labrador. Take care of yourselves and each other. I'd now like to welcome Minister Haggie to share his comments.
Thank you very much, Premier. I just want to take this opportunity to provide some clarity and some comments around the event at Ballyhaley earlier on in the week. While I have done several interviews and actually apologized on several occasions, I'm not sure that I've reached the entire audience, and I want to use this opportunity to reach our regular viewers, as it were, to repeat that apology. I think it's very clear that that decision was unwise. My concern now is really that public confidence in the public health measures and guidelines advanced by the Chief Medical Officer of Health may have in some way been shaken or weakened, and that certainly is not and cannot be justified. I've certainly spent some time reading messages and comments on social media and in my inbox These I've taken to heart. There are lessons that I have learned from this, and I've taken those to heart too. So once again, I wanted to use this opportunity to repeat that apology. I don't know that I have any more comments today, given the fact that from our point of view in the department, there is really very little new to report since Wednesday, other than what you have said and what Dr. Fitzgerald will be coming to mention shortly. So I'm not going to belabor the point, Premier, and I'll hand it back to you. Thank you.
Thank you, Minister Haggie. I'll now turn it over to Dr. Fitzgerald for today's update.
Thank you, Premier, and thank you, Minister. Throughout this pandemic, I've preached kindness and compassion, and I think that's what we need to apply here. We're in an enviable position, really, when compared to other jurisdictions, and I would like to say that I think the Minister is a big part of that. His willingness to listen to evidence and let the public health science lead the way is, an important part of our situation, where we find ourselves right now. The public health team and I have worked closely with the Minister over the past several months, and I really look forward to continued collaboration as we continue to try to control COVID, as well as with this much anticipated vaccine rollout. So now is the time to move forward with the important work that lies ahead. So moving forward with the advisory, since our media advisory yesterday, we have 3 new cases in our province, all in the Eastern Health region. First is a male between 40 and 49 who years of age and is travel related. The second is a male between 30 and 39 years of age, and the third is a female between 30 and 39 years of age. The exposure source for these 2 cases are under investigation at this time. There have been 5 recoveries since yesterday, so in total 312 people have now recovered, and leaving us with 27 active cases. The total number of cases in our province is 343, and in total we have tested 63,839 people. While we have had some periods of uncertainty in the last 2 weeks, we appear to have cleared the hurdles in the existing clusters, and they have not resulted in any new cases in recent days. This is really a testament to how well everyone is adhering to public health guidance, and I thank you all for your perseverance. That being said, we won't be out of the woods until things start turning a corner outside our borders. Provinces and territories continue to struggle to control the spread of COVID-19, and we therefore remain at risk from imported cases. Our best defense is our stringent self-isolation requirements for returning travelers and your cooperation in following the public health guidance. We've begun making contact with rotational workers returning home. This allows workers and their families to ask any questions about what is permitted and what precautions they should take. It also provides them with information on the numerous supports available. We have engaged the Red Cross to assist where there are obstacles to safe self-isolation and the provision of essentials. While our requirements for rotational workers are designed to strike a balance to protect the health of the public and the well-being of these families, we know it can still be quite difficult for them. These families suffer from harsh judgment, social isolation, and anxiety at times as they wait and wonder if COVID has made its way into their lives. We want to ensure that families know that they are not alone in this and that help is available if they need it. As a physician, I've seen firsthand that it is not always easy for people to reach out, to take that first step to ask for help. But please know that help is there when you need it. There are many mental health and addictions programs and services available in our province for people of all ages and circumstance. Please visit bridgethegap.ca to access age-appropriate programs and services that are available locally, confidentially, and free. If you are feeling anxious and alone, you can also call the Provincial Warm Line at 1-855-753-2560, 7 days a week from 9 a.m. to midnight to speak with a trained peer support worker who is there and ready to listen. If you or someone you know are experiencing a mental health crisis, please call the Provincial Mental Health Crisis Line at 1-888-737-4668 to speak with a mental health clinician. This service is available 24/7 to anyone who needs it. As I've said many times, I know there is so much fear in the public about COVID, and some of it is justified. But fear is not an excuse to mistreat others. You never know another person's circumstances or hardships. Life needs to keep going. Travelers will continue to enter our province for essential reasons, and that won't change. The best guidance I can offer anyone is to focus on your own actions and do what you believe is right. We cannot control what others do. We can only control how we respond to it. So choose patience, choose compassion. We are all navigating this together. We have begun administering the influenza vaccination in schools for children in grades 4 to 12, and these will continue throughout the month. Public health staff, physicians, and pharmacists have administered over 200,000 flu shots to date this year, and we're nearing 40% of the population vaccinated. All regions have surpassed their distribution compared to the same time period last year, which is very encouraging. As a province, our historical uptake on vaccinations is quite good, particularly for childhood vaccinations. Our key focus now is working with our federal counterparts to plan for distribution of a COVID vaccine in the new year. There are a wide array of logistics for us to determine, as this is anticipated to be the most complex and ambitious vaccine distribution ever delivered to Canada. We will provide updates as we learn more. As a recap, for those who may have just joined us, we have 3 new cases since yesterday's media advisory. The total number of cases in the province is 343. As we move into the second week of December, we have been fortunate to have some milder weather. So this is a great opportunity to get outside as a safer way to socialize. When indoors, where socializing is more risky, please remember your layers of protection. Keep your close, consistent contacts to no more than 20. That's throughout the Christmas season. And if you feel unwell, stay home and don't allow visitors. Wash and sanitize your hands before entering stores, and maintain physical distance from those outside of your close contacts, even when wearing a mask. Stay safe and hold fast, Newfoundland and Labrador. Thank you.
Thank you, Dr. Fitzgerald. I'll now open it up to questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 4 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have any final questions. Our first questions are from Peter Cowan with CBC. Please go ahead.
Thank you. Premier, you said you wanted to sort of clarify things around parties, although I think a lot of people in the public are confused. You've said you don't have any issue with your ministers holding in-person fundraisers with 20 to 40 people as long as they're following under the public health rules. Do you have issues with employers holding similar-sized Christmas parties if they follow the rules?
Well, the message I delivered today, Peter, was that and I think that Minister Haggie spoke to this, that in retrospect, the timing of that wasn't great, and he apologized for that. What I was referencing, though, was that public health guidelines were followed. Perhaps the spirit wasn't reflective of what we're trying to achieve, and for that we're sorry, and we'll endeavor to be better.
Dr. Fitzgerald, a lot of people have been wondering what your take is on these events. Again, they followed on all your rules, but they came the same week that you were recommending employers not hold similar events. What do you make of these in-person fundraisers?
So I think I answered those questions in my opening remarks, so I don't really have anything else to say about that, Peter. If you'd like to ask another question, you can please go ahead.
I listened to your remarks, and it didn't really seem to directly address these specific events, though, because a lot of people have been wondering about it.
So, I think once again we've been fairly clear in what we expect, and I think people have apologized, and I think we need to move on from there.
Okay, thanks.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Premier, in regards to these political fundraising events, we've heard from from many members of the public, and there's been a lot of public outrage in regards to this. Do you understand that outrage from the public, and what do you say to them?
Certainly. As I mentioned, as leaders, we're held to higher standards, even though the standards were followed. We're held to higher standards, and in retrospect, the timing wasn't great of these events, and for that, we'll endeavor to be better. We will be better, and it won't happen again.
Thank you. And people have been canceling Christmas parties and gatherings based on requests to seriously consider restricting contacts to 20 or fewer. Rather than argue semantics, what is your response to the public's perception that political fundraising activities at this time, in the wake of the two clusters, was ill-timed and bad policy?
Again, like we said, the timing was not great, especially given the spirit of what we're trying to achieve, and we've apologized for that, and it won't happen again.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Just to clarify, is it 50 or 20 for gatherings for the year? Because I know we've been saying 20 for 2020, but online we're saying 50 for indoor events, as long as physical distancing and public health guidelines can be followed. So for the record, 20 or 50?
So 20 for 2020 refers to maintaining 20 consistent close contacts over the holiday season, that you would, not have interactions with a lot of people outside of those close 20 contacts that you would have on a regular basis. So, your close family, your close friends. What we're recommending is that people would try to limit any gathering that they will have to less than 20 people, provided that the space could accommodate 20 people. Right now, in our special measures orders for informal gatherings, we have a recommendation, or a limit, I should say, of 50. We have, as I said earlier this week, we have been looking at this, and we will be reconsidering that number in the near future.
All right, thank you. Moving on. To vaccines, the federal government is saying a soft launch or dry run of the Pfizer rollout will happen in every province on Monday. Are we prepared for this?
We've been working with the military to have tactical training operations even as we speak in terms of that initial dry run, and then there will be a subsequent stress test of the distribution in the oncoming weeks. But we've been working closely with them on that.
Thank you.
Our next questions are from David Marr with The Telegram. Please go ahead.
Thank you very much. Dr. Fitzgerald, I'm wondering, with regard to the vaccine, is there any understanding at this point as to whether this will be an annual vaccine, like we see with the flu shot, or how often would the vaccine have to be administered to ensure to protect the population?
Yes, so we don't have the answers to that at this time. We have a recommendation for how to give it now, and that it will be two shots to get a full series, but we don't know if that's what the long-term effectiveness of the vaccine will be. It's just not been enough time yet.
Okay, thank you very much. And from your Furey, I'm wondering, you commented on the PEI decision to remain outside the bubble at this point. I'm just wondering how much does that province's decision weigh on what will be decided on Monday?
Well, Premier King and I chat quite frequently, but of course we're evaluating the same evidence that he's evaluating, and the variables that we're weighing are very similar to his in terms of, raw, as we've suggested in previous briefings, the absolute numbers in combination with non-epidemiologically linked cases. So we're going to watch over the weekend and make our decision on Monday.
Thank you again.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Statistics Canada today said employment numbers in Newfoundland and Labrador have rebounded even up a bit since the start of the pandemic. Premier, what do you make of those numbers?
Well, obviously that's in the right direction, but numbers in the midst of this time of uncertainty is just a biopsy. It's just a shot in time. We really need to look at trends, especially as we emerge from a crisis. I think it'd be, although encouraging and certainly better than the other direction, we really need to concentrate on the trend, and that's what I'll be looking for. That's what we're going to be working hard towards as we emerge from this pandemic with a stronger workforce and stronger opportunities for families.
You were talking about the stress test there. Can you give me an idea of what does that exactly entail for this province? What are we going to be testing on Monday?
Well, in terms of Monday, it's a tactical exercise that has really already almost started in terms of just the ability to deliver the vaccine itself. So just operationalizing a distribution from other countries to Newfoundland and Labrador. And then the stress after that will be in the coming weeks if we can actually execute then on distributing it about Newfoundland and Labrador. Of course, given some of the nuances and some of the challenges with respect to geography, but also in terms of the stability of the vaccine itself.
Okay, thanks.
Our next questions are from Richard Duggan, VOCM. Please go ahead.
Thank you. I want to ask one more question about the fundraising events. I'm just curious, given what has been going on, how many of these events have been held to date, and are there any more planned?
All of them that have been held to date have been within public, to my knowledge, and both. And I can't comment on the other parties as they've also had these, but have been within public health guidelines. I'm not sure the total number, but we can certainly get that from you from our perspective. As for ones going forward, we're going to follow public health guidelines, but it won't happen again.
Thank you. And in regards to the provinces and territories have been told to be ready to accept COVID-19 vaccines as early as December 14th. How will you determine the priority areas in the province for who gets it first?
Well, that's what this team that we announced today, in combination with Dr. Fitzgerald and her vaccination team, will fully assess out and work with the distribution team in order to figure out the best way logistically, but also from a health perspective, how to get those to those who need it the most first. As we've mentioned many times, that this vaccine won't be available to everyone right away. This will be a triage, priority-style approach that will be based on science and evidence and start with protecting the most vulnerable.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Is there any indication yet on which vaccine we would be getting, whether it be the Pfizer or the Moderna? And with the difference of them, there's difference in storing it. Do we have the capacity to do that?
I'll get Dr. Fitzgerald to comment, but it's likely we're going to receive a combination of them, and perhaps even the other one as it becomes available in Canada. And you're absolutely right. There's different requirements for each one of these, and that's part of establishing a team to make sure that we have the supply chain and the freezers, for example, required in order to not only store it, but then to distribute it across the province. Do you have anything to add, Dr. Fitzgerald?
Yep. So the first likely will be the Pfizer product that we will get, but we do expect to receive both Pfizer and Moderna product in the first quarter of 2021.
Thank you. And we're seeing a lot of information coming out very quickly on these vaccines. It's kind of hard to keep up with it as it's continuously changing. But when it comes to the vaccine, right now, and maybe I've read this wrong, but kids can't receive the vaccine?
It has. Did you say children?
Yeah, it hasn't been approved.
It hasn't been studied yet.
For children under 18 or under 19. I'm sorry.
They are working on that, though, as
Yes.
I understand it. There's trials ongoing.
No, for sure. I just wanted to clarify.
Yeah.
There's just a lot of information out there on it.
Yeah.
Our next questions are from David Marr with The Telegram. Please go ahead.
Thank you very much. The two cases announced today that are under investigation, I'm wondering, are they at all potentially related to the to the situation down at Grand Bank, or are these potential kind of a unique scenario?
So these cases just recently came to our awareness, I guess, and so the investigation's ongoing. I really don't have any information about them at this time.
Okay, thank you.
Other than what I've said already, yeah.
And I'm good, Kelly. I got a lot of my inspection questions, so you're good to move on. Thank you.
Thank you, David. I will now go back through each reporter to see if you have any final questions. Peter Count with CBC, do you have any final questions?
Yeah, vaccinated-related question. Will the vaccine be mandatory?
Highly suggested, but at this point we're not considering legal measures to make it mandatory if that's what you're considering.
Why take that approach?
Because it's a free and democratic society, and people have choices, and sometimes people don't make the right choices, but people have choices, and we are suggesting that once it's approved by Health Canada, that this will be a safe vaccine and that everyone should avail of it when it's available to them.
Thanks.
Richard Duggan with VOCM. Do you have any final questions?
Yes, Dr. Fitzgerald, with the Christmas season now in full swing, and we are going to start to see families and other groups start to gather within that 20-person extended holiday bubble that we've been talking about. What advice would you have for those groups who may not be in the same bubble, who want to hold a gathering at, say, a restaurant or any of these other venues? What advice would you have for them?
So certainly the same advice that we've been saying all along, which is, you should keep your distance between bubbles and wear your mask when you're in indoor public places, and make sure you wash your hands well. Don't share food. Don't host a gathering or go to a gathering if you feel unwell. All of those things, certainly I would refer anyone to the advice for gatherings that's on our website to get more details on that.
Thank you.
Kellyanne Roberts with NTV. Do you have any final questions?
I have a clarification and a question, if possible. The clarification's on Richard's question there. So just wondering, online, like we saw for Halloween and that, there will be one for Christmas?
There is already one there for Christmas.
Oh, thank you. And well, the province, I know we've already spoken in Bass about the vaccine and a vaccine committee, but the federal government's also looking for distribution centers to be ready by the December 14th deadline. That's the federal team's request. Are we in the process, or are we going to meet that deadline?
This is all the hard work that's currently being done by Dr. Fitzgerald and her team, and now, of course, this team that we've introduced. And so, I mean, we're moving towards that, and hopefully we'll get there. This is obviously a changing dynamic, and but we have some of the best professionals in the world here in Newfoundland and Labrador, and I'm confident in them and their abilities to execute on this.
Thank you.
David Marr with the Telegram. Do you have any final questions?
I'm good. Thank you very much.
Thank you, everyone. Premier, do you have any final comments for today?
No, just thank you all for coming, and I'd like to echo some of Dr. Fitzgerald's words in terms of being kind to those around you and look after yourselves and each other, and together we will get through this. Thank you.
Thank you, Premier. Take care, everyone. Stay safe.